Hi there, and welcome to the presentation of the new devices that patients are wearing in the hospital and in the community called flash glucose monitors and continuous glucose monitors. I'm going to review the hospital policy and what the responsibilities are of the patient and the nurse. So we've had several options for measuring glucose historically. If you're old enough, you remember urine testing for glucose. That's not really effective because it takes about 3 hours for that glucose from the bloodstream to get into the urine, so it's quite an old result. And of course, currently we're measuring point of care testing, so a CBG. What that CBG shows us is what the glucose is at this moment in time. It doesn't tell us where it's going, or what's happening in between those tests. These new devices are showing us what is going on in between the spot testing and the CBGs, as well as the direction that those glucoses are going after they have been calculated. So there's a difference, though, between a capillary blood glucose and an interstitial glucose. They're two different compartments. So a capillary glucose puts a firm lancet into the finger, creates a hole in the little capillary, and we take a drop of blood. And that's a very accurate way of measuring glucose. An interstitial fluid glucose monitor is measuring just that. It's measuring all the glucose that's diffused from the capillary into the interstitial fluid that's surrounding the cell, and just before it's taken up by the cell, which insulin is, its job is to carry it into the cell. So you can see with this travel time that happens here, there's going to be cases where the glucose readings won't match identically, and especially if the glucoses are changing very quickly, there's a lag time or a delay, and it does take some time for that blood glucose result to get up to the filament in here. So this lag time can be described as being on a roller coaster. If blood glucose is always in the front car and the sensor glucose is in the back of the car, the train and the roller coaster, when that glucose is steady, then everybody's going to read about the same glucose. So when the trend arrows are pointing straight forward or just rising slowly, they're going to read within a good range of each other, pretty close. But when the glucoses are rising quickly or dropping really quickly, you can't expect it to read exactly bang on, because there is that lag time that happens. So we always revert to a finger poke if we're ever in question. So the lag time for the FreeStyle Libre flash glucose monitor is about between 4 and 18 minutes. And for the Dexcom G6 or Guardian 3 continuous glucose monitors, or CGMs, they're about 4 minutes. So do you have to do a point of care testing? Well, you may have to do one on the Libre if the glucoses are going up or straight down. In the Dexcom G6, its accuracy is quite good, and so it does not need to follow with a point of care testing because we can rely on that number. And the Medtronic Guardian 3, we actually do have to do point of care testing all the time with that one. It was originally marketed just to speak to an insulin pump, and now it's being worn separately. But for the current time, we still have to do a point of care testing to confirm the result. So the two systems, one is a flash glucose monitor. The FreeStyle Libre is the only one on the market. There will be more coming, and currently I know there's a Libre 2 in the works. So all of this policy is based on the first generation of the Libre. So what it does is it will requires a device to pull the number out of the sensor and transmitter that's all located in one device. You have to actively get the number. It won't just tell you you're going low. Whereas a CGM or continuous glucose monitor like Dexcom or Medtronic will actually tell you and call to you and say your glucose is going low or high, you should do something about that. So the sensors provide more than just the glucose reading, they provide the direction the glucoses are going. So here's an example of the Dexcom in the middle here. It tells you whether the glucose is in the gray range, which is good and it's normal and within target, and the patient would set their own targets on their own device. But it also says the glucose is rising quite quickly with these double arrows up. So we know it's 5.3, but we also know that it's going in an upward direction, meaning they probably just ate. This one here is telling you the glucose is lower than the target range, so it's less than 4 typically is what we put in as a low end of target, and it's going lower. So this means this really needs to be treated because the person's having a low and it's continuing in a low direction. Whereas this one here tells you it's above target, typically 10, and it's in the yellow range, and it's going up, but fairly slowly. So this one is what you're going to see most of, and that's the FreeStyle Libre trend glucose graph. And it's going to tell you whether it's going stable forward, whether it's going up or down slowly, or whether it's going up or down very quickly. And again, you would only trust the number if it's in this middle range here. If the glucose trend arrows are showing straight up or straight down, you need to follow it with a finger poke because of that up to 18-minute delay time. So the coverage has expanded greatly in Ontario for sure. It's the only province in Canada that covers it for just 1 injection a day. And to my knowledge, only Quebec covers it at all, and it's for 4 injections a day, and no other province is covering it. So we're very lucky in Ontario. It is covered under patients who have at least 1 injection a day of insulin under ODB, OHIP+, Ontario Works, Trillium, or Disability. And this is why you're seeing this device much more often than you would a CGM. So the components of a flash glucose monitor are the sensor and transmitter are one device. They are inserted as one. They are removed as one. They can't be reinserted once they've been taken out because it goes in as one device with an inserter that is, once it's locked out of place, it's similar to your needles where you can't reuse that needle. So if it needs to be removed for something, a new one has to be put on. Those sensors are about $100 each. They last 2 weeks at a time, and the patient changes it every 2 weeks. It will do a countdown and say that it's not going to work anymore because there's only, it's expired. It will go to either a reader, which will you flash over top of the sensor. It doesn't need to touch. It just needs to come within about 1 inch of the device. It can go through clothing, through ski clothes, and it also can be loaded up to an iPhone 7 or newer or a Samsung 5 or newer. So it can be flashed with the phone as well. The benefit of this one here is that it will, it has a port that a patient could test not only blood glucose readings, but ketone test strips as well as flashing. But the benefit of the phone is it has more features in terms of analyzing the data. So the continuous glucose monitors, Dexcom G6 and Medtronic Guardian 3, the Dexcom can be worn alone or in tandem with a tandem insulin pump. It can be worn in combination with the tandem pump. But it is a very accurate CGM. The Medtronic Guardian 3 was initially meant to just talk to your insulin pump and not be used independently, but as of just a very short time ago, they have said that they can now use it independently, and they download an app on their phone in order to read it. However, you still have to do point-of-care testing. So with the Dexcom G6, you don't have to test. You don't have to follow it up with a finger poke. You can trust the number. Whereas with the Guardian 3, it's not indicated with to make decisions off of unless you do a point-of-care finger test. So the Medtronic Guardian 3 has got a sensor. This is just tape here. It's got a needle that's going into the patient and a port to put the transmitter, which is this very expensive white thing here, gray white. It is almost $1,000 for these transmitters. And if you throw it out, a patient has to purchase it again, and those transmitters are good for about 1.5 years. It can, again, read to a insulin pump. That's typically what its main job is to do, is to tell the pump how much insulin to put out in between meals, and then the patient makes the decision at a meal to tell the pump how much insulin to put in for that meal. But now, again, it's been indicated now to be worn independently. And the Dexcom system has many ways you can use this. It can be worn independently. It can be worn with this tandem insulin pump. It can go to a receiver, your cell phone, both iPhone and Android, as well as smartwatches. The FGM and CGM policy, just want to note that in FGM in particular, there's a possibility of some degree of error in that first 24 hours after the insertion. So if their symptoms don't match the FGM result, confirm with point of care testing, please. If they're saying I feel low and it's flashing at 5.2, check it with a point of care test. So the FGM policy highlights are that the patient must provide all of their own supplies. There is no one in hospital that can bring them supplies, no pharmacy person. We don't hold supplies for these devices. So if they don't have the supplies, the device comes off. We go back to point of care testing. Only if the trend arrow is pointing in the forward direction, meaning that it's not pointing straight up or straight down, we can use in this red area the glucose result in order to treat off of for a sliding scale or make decisions regarding their treatment. If it's pointing up or down, you need to follow with a finger poke. For certain diagnostic imaging tests, it needs to be removed, and I'll go through those. And your responsibility as a nurse is just to monitor for signs and symptoms of infection. Remove it if you're concerned, and I'm going to go over how to take that off. Just remember there's a flexible filament that's left under the skin, and so it's very easy to take out, and you won't harm the patient no matter what direction you take it. The CGM policy highlights is that the Dexcom G6 can be worn alone or with the tandem insulin pump. You don't require point-of-care testing. You can rely on all those results, and it's for 2 years and over. Whereas the Medtronic Guardian 3 can be worn alone or in combination with the Guardian 3 insulin pump, or the 670G insulin pump, and provides a constant message to the pump. You have to use a special meter with it that the patient will do all on their own. There's no responsibility for the nurse for this because that meter has Bluetooth capability and can talk back and forth. And it is for 7 years and older. There are a combination here. The patient has to provide all their own supplies, has to be removed for the diagnostic imaging test, and then you monitor for signs and symptoms of infection. So same responsibilities there. This is the diagnostic imaging chart of the test that it needs to be removed for, which is MRI, CT scan, and whole body density scan. These are the tests that you would put lead shielding over, and the device can remain on without lead shielding of any sort in these ones. Diagnostic imaging has been consulted in these policies and has this list as well, but you do need to tell diagnostic imaging that they have one of these devices on so that they're aware. So it is contraindicated. All of the devices are contraindicated in pregnancy, dialysis. If they're critically ill, the fluid shifting is just too great to rely on the number. Diabetic ketoacidosis, fluid overload or generalized edema. Again, we're not sure how the device would work, and so we won't trust it. Under the age of 18 for flash glucose monitor, and then for the CGM, of course, those other age limits, and altered level of consciousness or unable to care for their device. So how to scan. This is what a patient may, if they've had a stroke or they have some form of problem doing it themselves, they may just say, can you help me out with this? There's one button on this reader. If you're using a reader, you press that button, turn it on, it will say check glucose, which you just press on the screen and flash it over top. You're going to hear an audible beep beep when it's captured the number. For the app, hopefully the patient doesn't have a lock on it. This is what the FreeStyle app looks like, and so it just gets opened and the phone is scanned over top. Please remember, though, that if you can't get a beep beep from it, then flip the phone over, because iPhone uses the top and the front of the phone to scan, whereas Android uses the back of the phone. So when can you use the result? Just reinforcing that you can only use the result if it's in this time range here. And if it's straight up or down, you need to follow with point of care testing, and that's for the Libre. How to remove the Libre? Gently lift all of the tape around the edge, pull it. That's all that's there. That flexible filament, you can see it's actually kind of bent in one direction. It will not harm coming out. It'll come out whatever direction you pull. So it's not like a firm butterfly needle that has to come out in a certain way. And then there are policies and order sets which are just getting approved very, very shortly in the next week or so. And there'll be a flash glucose monitoring. This is where you'd find it on the policy library once it's posted, and a continuous glucose policy. And then there'll be order sets so that when a patient comes in and they have this device on, you don't have to rewrite everything. There will also be a cardex that the person transcribing doesn't have to write anything from the order set. They just pull the cardex that's associated with it and put it in either the medication binder or the cardex, whatever system that you use. There's also patient education material that's going to be loaded to the patient ed site. So thank you very much. If you have any questions, you know you can always contact myself or my colleague at the General, Cynthia Iamarino, and we're happy to answer any questions for this. Thank you.